during GU ASCO and ASCO, we saw a lot of update on these major frontline trials that define how we treat metastatic clear cell RCC. Now, a caveat in a way with all these trials, they had sunitinib as an active control, and we know now we're moving. So all these trials now were not, this combination were not compared against each other, starting first with the IO combination of nivolumab, ipilimumab. We saw a 4-year update of that combination, again confirming a hazard ratio in the 0.7 range and a strong survival benefit with the nivolumab and ipilimumab combination versus sunitinib that, you know, stayed beyond, you know, all this follow-up and confirming these responses, these complete responses, to be around 10–11%. So this is a very important regimen, frontline, that continues to show you know, how important and how superior it is to sunitinib with more follow-up. Another regimen at ASCO 2020, Dr. Plimak presented an update from the pembrolizumab axitinib. So that's not an IO, it's an IO-VEGF combination that showed that the hazard ratio for overall survival, where it went up from 0.53 to 0.68, still the regimen provide a very important survival benefit in this situation. And the rate of complete responses also went up. There was no new safety results against a superior regimen against sunitinib, but it's not an IO, it's an IO-VEGF regimen. Another approved regimen is axitinib again, but with the PD-L1 inhibitor avelumab. This study I personally was involved in, continued to show a progression-free survival response rate benefit, but at another interim analysis, there was no overall survival benefit with this combination. We can always say how, why, is this a different drug? Is this, a control arm, different population, subsequent second-line therapies? But at this time, the only two combinations with an OS benefit and approved are the IO combination of nivolumab, ipilimumab versus the pembrolizumab, axitinib, VEGF IO combination. One thing to mention, a press release, we don't have major details, press release showing in April, I believe, that the combination of cabozantinib, nivolumab, so VEGF, MET, XL inhibitor plus PD-1 inhibitor, is also superior to sunitinib. That's one of the remnant of all these studies against sunitinib in terms of overall survival. So hopefully we'll know more details about this regimen, and the question how it's going to pan out if it gets approved against pembrolizumab, axitinib. The devil probably is in the detail.